Okay, this is perfect. So, hello everyone. Thank you for joining us at our Rett Rounds. It's called tonight's session is called Supporting Families in Decision Making. These education series are sponsored by Acadia Pharmaceuticals, and we are grateful for their partnership in helping us provide knowledge to our community. Tonight, our guest speaker is Dr. Joanna Humphreys. She is an assistant professor at McMaster University, and she is also a physician at McMaster Children's Hospital, and she specializes in quality of life and advanced care planning. Dr. Humphreys also worked in the Rett Syndrome Clinic at the Hospital for Sick Kids, and we are so pleased that she could join us this evening and to tell us a little bit about decision making and supporting families through this process. So, thank you so much for joining us, and we can't wait to hear your presentation.
Thank you, Sabrina, and thank you to Acadia for sponsoring this talk tonight. As many people know, all girls with Rett syndrome have a very close place in my heart, and I feel really privileged to have worked closely with them throughout my palliative care training, and now really cherish the work that I get to continue to do with them in my practice. They are some of my favorite girls. So. I am going to start sharing my presentation, and um, today is to really focus on you and to give you, as parents and potentially as healthcare professionals working with children with Rett syndrome or any other really developmental disability, just some ideas to think about when trying to make some difficult decisions. We know that families of children with medical complexities face difficult decisions every day, from little small ones of do we go to school today or not, to really big ones about when their children are more unwell, to huge ones about what to do in the future if parents aren't there. And so I do not propose to have any of those answers for you. But what I hope to do is to equip you with a few tools to help you to make those decisions as you go along your journey. So a brief land acknowledgement. We are all on different traditional lands today. And for my land acknowledgements, I really like to try to highlight someone in the Indigenous population who is doing some beautiful work, just to give us all a little bit of thought about how we can continue to work closely with members of our Indigenous community to try to make sure that we are not just pretending to be right, but working to be right and working to align ourselves with the Indigenous practices. Dr. Holly Prince is phenomenal. I had I had the pleasure of hearing her speak at a conference last year, and she's very passionate about community palliative care. As a social worker and PhD, she is an Anishinaabe and a member of the Opawaga-Nising in northwestern Ontario. What I really love about Holly is this concept that she really brings to light of there is medicine in diversity and diversity in medicine. And I think this really is what we should all be trying to embody from what we learn from the Indigenous communities, but also all of the people we work with, that everyone is an individual. Everyone brings their own background, their own spirit, their own life experience with them into their medical journey. And it is so important for us in healthcare to constantly be learning about that, reflecting on that, and incorporating what we do in healthcare with the individual in front of us. So it is very nice to meet you all, and I thought I'd just tell you a little bit about myself as to why this work is important to me. I'm at McMaster University, as Sabrina mentioned, and I work on the quality of life and advanced care team. And we're really a team that you would label as a pediatric palliative care team. So yes, some of the work I do is with children at end of life, but I would say the majority of work I do is with children, like many girls with Rett syndrome, who have medical complexity, who potentially could have a shortened life. And really, our goal is to work on quality of life. But also the big piece that we're really going to focus a bit on today of like advanced care of like what is that? Which is like, what can the future look like and what can we do to help you prepare for that future? And that's a bit that I'm really passionate about, this kind of advanced care planning piece, and how we can kind of really weave quality of life into all of the patients that we see, including all our girls with Rett. So today we have a fairly lofty goal that we are going to try. I'm going to try to navigate you through. There is lots more to be said than what I have to say, and lots of questions that need answering. But I hope we can just touch on some of these concepts to help you on your journey. So we're going to talk about navigating long-term care planning or advanced care planning and medical decision making, discuss the balance of clinical realities while maintaining quality of life, which I think is one of the hard things to do in A, probably as a parent, B, as a healthcare professional, and then C, as that dyad working together of how do we do that together. I'm going to talk a little bit about community supports and palliative care resources, which I think are relevant to the Rett community. And then if at the end we have any time for questions, we'll go from there. So advanced care planning is really looking forward to the future. So kind of think of it as what if medicine. What if the road were to take us this way? What if it were to take us another way? And if you look at the Canadian Pediatric Society statement from 2008, which has recently been affirmed, 2008, they say this is standard of care for any child with a chronic disease. Any child, and I would say any human. And I think this is something we don't pay attention to enough in healthcare and why I'm so passionate about it. So it's basically a process of trying to plan for the future and establish goals of care. So it's an extension of the normal discussions about what are the treatment plans we're doing here is looking at long-term goals, short-term goals. What are we working towards? What are the what ifs in the future? It can be thinking about medical decisions. It can be thinking about decisions such as social integration and, family planning. Um, the idea is for all of these things that we try to discuss and think about these things for a moment of crisis. And that moment of crisis can be lots of things. Not going back to school, how are we going to socially integrate? The main caregiver becomes unwell, hurts their back, and can no longer lift. What are we doing? Feeding gets more difficult orally, and we need to think of other things. Or, unfortunately, sometimes in my world, you know, children become seriously unwell. And what are the things we're going to look forward to for the future? This may include drafting formal advanced directives, and if you look at all of the adult data, that's what they're looking at. But in kids, we definitely do it, but I don't feel like it's a big must, at least for me in my practice. I think this should be a standard of care. I think it's longitudinal. So this is not just a conversation you have once. This is a conversation that you and a family are able to have as much or as little as is needed, given the clinical situations, and as much as needed based on what a family is needing in terms of making decisions. So this is where, one of my big points tonight is to trying to advocate to you to not just leave this to something that's in the physician's hand to dictate how often they talk about it, but for you to dictate, saying, I'm good. We've made progress. I don't have anything now, or quite the opposite. I'd really like to talk about this. I think the sooner we do this and the more we do this, the more it just becomes the normal part of our conversation. And I think that's really important in healthcare, that this isn't, some of these conversations aren't just at that moment of crisis, that we're doing the planning beforehand. So everyone in the developmental world will know our Fs. Function, family, fitness, friends, future. And so with the team at Holland Bloorview, a bunch of us looked and see how we could really kind of holistically integrate advanced care planning into the F words. And to me, this really is a definition of advanced care planning that really resonates and um, strikes, I think, what I hope is the right balance. And that we're not just looking at future health, where we're looking at severe illnesses or resuscitation. We're looking at other things like family, long-term caregiver, financial planning, friends and fun, function. What are we looking for in terms of, fitness? And I think this makes advanced care planning seem less daunting when we look at it in this way, because we are looking at the future of a child and we're not just focusing on the medicine, we're focusing on the whole future for that child. And this is huge in helping to make decisions, because if you've actually thought about these things beforehand and not in a moment of crisis, it can really, really help you help to inform your decisions. And that's because you can do lots of different things that I will talk about in a second. So this is a kind of a more, this is a very busy slide, but more in-depth idea of what we kind of really thought about this holistic advanced care planning. Developmental needs, including anticipated learning and future functional skills. We know how important function is with girls with Rett syndrome. What are we doing to help them communicate? What are we doing to keep them active in ways that work with their developmental stage? What are our equipment needs that we need now, but maybe in the future, especially as the girls grow up? Um, Opportunities for participation and inclusion are huge. Our girls are so smart. Your girls are so smart. They're in there. And how are we going to, in different ways with different challenges, really look at building social skills, really look at giving them those opportunities for inclusion? And that may be different when you're dealing with a 3-year-old, but it's thinking about how are we going to start this integration so that when your kids are 11, we've kind of worked through some of that stuff. Thinking about you as the caregiver. What happens when you can no longer look after your child? What happens if finances changes? What happens if something happens to your back? How can we help support you from not burning out? Future medical needs. I think this is a big thing, especially with any child with medical complexity or developmental challenges. Like how, like what is feeding going to look like in the future? What are the risks associated with the disease that we need to be constantly looking about? And it's not just when they come up we talk about them, but maybe there's some things we need to talk about beforehand. And then the last piece, which is the piece which is something often my team and I do, is the kind of preparation in case of severe life-threatening illness. And these are things that we never want to talk about. And in the majority of girls with Rett syndrome will not be an issue, but we know that they can be. And we know that these things may happen when we're not expecting them. So what are our thoughts about this? And it's not that we have to make decisions to limit care, to limit medical interventions, but saying we've thought about this and we don't have any limitations to what we want to do. I could talk about this till I'm blue in the face, but this is actually more important to me, is this 5-step process. And I almost think that the plan and share on the right-hand side of the screen are a lot less relevant. To me, the thing that is most important here about advanced care planning to help us make decisions in the future is thinking about it. Thinking about, should my child need a feeding tube in the future? Should we lose ambulation? Should these things happen? What is most important to me? What are the things that I want to make sure at that time that I'm thinking about? And we know that thinking doesn't happen in a silo. We as healthcare professionals, you'll be surprised to hear, sometimes can get a little egocentric. We're like, we haven't had this conversation with the family, so they can't be talking about it. We all know that is complete and utter, insert swear word here. It is important for you to talk to the people that are important in your life. If you're a single parent, if you're a dyad, talking with the people around you who are most important. That can include your healthcare team. Maybe it's your occupational therapist who actually has the greatest perspective on what the future may look like. Maybe it's other people in your community. Maybe it's, going to a wonderful Orsa Rett event and talking with other people who have to face similar challenges, like, would we get a feeding tube? And then it's learning. It's going back to your healthcare professionals, going to appropriate resources and saying, what do I need to know about this? And to me, that is the most important thing of advanced care planning. It is setting yourself up so that if these things happen in the future, you have all the tools in your tool belt. And yes, for some families, there's a place where there is a plan that if our daughter needs a feeding tube, we'd like to go ahead with this, but we want to still work really hard on oral feeding and continue to work with the occupational therapy to feed for not nutrition necessarily, but maybe for pure enjoyment. And that, yes, we know there's a risk of aspiration with that, but we're willing to take that risk. And obviously, if any plans are made, it's important to share. But I think we underestimate the importance of these first three steps. And these are things that often happen outside I hope not 10 minutes, but short appointments you may have with your healthcare professional. But those are also times to make sure that you're talking, thinking, and learning. Um, this is a little video that kind of goes over the five-step planning. Maybe what I'll do, Sabrina, is send you the link to it. I think for today we won't play it because it really talks through everything that I've seen, everything I've said. It's based on kind of one of the adult videos. It's got a snappy tune. I'll let you hear the tune. There you go. And it's really just talking through the steps of the postcard that I've already outlined to you. Um, One of the reasons why I think advanced care planning is so important is it's very strong link with quality of life. So quality of life, when we think about it, everyone, it's this little bit of a catchphrase. And I think it can mean different things to different people. And I think healthcare professionals use it sometimes in very different ways. But for me, when I put these two together, what it says to me is that no matter what is happening and what may happen in the future, how are we, no matter what that situation, still going to be able to focus on quality of life, even if that quality of life definition changes? So we know for many, many girls, eating orally is a huge part of quality of life. Um, but if we think to the future for some people where they need to use a feeding tube, maybe our definition of quality of life has to shift and change a bit. But I want to be focusing on no matter what happens, if we're needing feeding tubes, if we're ill and in the hospital, no matter what is happening, even, God forbid, a child is at end of life, that in that moment, given those exact circumstances, we are able to focus on quality of life. And that quality of life is different. Yes, it may not be, our big lofty goals of development, but that in that moment, whatever quality of life looks like, we can preserve it. And I think that's why it's so important to do the advanced care planning. So in those moments, we can have thought about what quality of life mean if the what if were to happen. And we can also make sure that we're focusing on that, not all the medical decisions surrounding it. I think when it comes to advanced care planning, there's a lot of tough things. When we're going through the five F's, there's a lot of fun things, but there's also really tough things. And these are things that some families may feel I never need to talk about. Um, and that's completely fine. But we all know, I think any parent would tell us that you're always worried sometimes about the worst case scenario. So it is very hard to think about what were to happen if our child were to become very unwell, need to go to the ICU, lose function significantly, lose the ability to feed orally. If primary caregivers were to become unwell, physically, mentally, or as our girls age, what they're going to do. when as parents, you are much older? What if a child was no longer able to live with you? What if you felt your child, based on what was happening in their life, had poor quality of life? And I think these are the harder ones to discuss and ones that I urge you that if they are on your mind, these are ones to bring up to your healthcare professional. These are easy ones to avoid, especially while everything is good. But these are the ones where you can really get incredible support, education, um, and the ability just to say these things out loud. The the concept that if we talk about it, it's going to happen is something pretty scary. But we know that's not the case. It's easy to say that when you're not emotionally attached. But just because we talk about these things, it doesn't mean they don't happen. It doesn't mean they happen. My apologies. Um, and from what we hear from parents, if we're actually able to engage in conversations like this, it can be really reassuring and can help them make decisions in the future. I think the biggest barrier to these conversations is clinicians, is us, because we often have a million things to do in an appointment. And the one thing that may be a little bit harder to talk about may be something that may fall to the wayside, especially if a child is doing really well. And so, if these things are on your mind, don't wait for us. You guys are ahead of us on everything else. So push us, make us have these conversations. Say, hey, next time, can we make time for this? Can we have an additional phone call? Can we have an additional appointment? These are things that are important to me that I want to talk about. That we avoid topics that have a low probability of happening. It's that if we talk about it, it's going to happen, or we're so far away from that. But if it's on your mind, if it's something you're thinking about and worrying about, then it's worthy of a conversation. I've had a few families recently where there's a real lack of trust with the healthcare system, which I have to say, working in the system, I can understand. Lack of trust of saying the things that you're worried about. Does this make me we'll get there, good parent? Does this make me a bad parent if I'm worried about my child not being able to live with me long term? Do I trust the person in front of me that they're not going to think something poor of me? Or do I trust that if I say something to them, that it will change the way I'm viewed or seen? And that's one of the barriers which I find really weighs on my heart a lot. And so I don't think there's always a right person to have these conversations with, but I think it's finding a person who you trust, a person where you can have that open, honest conversation about the things that you are worried about for the future and to help support you with information about how you may make a medical decision or any other decision in the future. I think uncertainty in the future is a big piece. And I think this is for girls with Rett syndrome, other girls with medical complexity, well, all children with medical complexity. But we don't know if that's going to happen. We don't know what the future holds. So why are we wasting our time on this? And I would flip it the other way, is that we don't know what will happen. But especially when our children are well and our patients are well, it is that time to potentially prepare for the future. We do all that with our finances, with so many other things in life. Why wouldn't we do that with our child's health? And I think these are sad barriers, but they're ones that I think together as a clinician family dyad we can work through. But I also really want to advocate for you as parents and people working with children with a degree of medical complexity to advocate if this is something that you want, to advocate for it. If there's things that are on your mind, to talk about it. Okay, now we get to the really fun stuff. Um, Medical decision making, even when we're thinking about it in the future or if we're making decisions in the moment, is so hard. There are simple decisions. My child's got an infection. I'm going to give antibiotics. Wonderful. But there are a lot of complex decisions. And there's ones that as healthcare professionals, we don't know that you as parents are making every day. And I want to talk through four concepts that over time I have found really important to talk about when talking about how to make decisions. And that's the concept of uncertainty, clinical narratives, probability of events happening, and this concept of being a good parent. So I hope you bear with me. This is nothing I'm taking from textbooks or the literature. This is something really from my clinical practice. So, uncertainty. If we are in adult healthcare and we are dealing with someone who has had a heart attack, or someone who has vertigo, what the adult doctors can do is they can look at their Google map and they say, yes, we're going to do A, B, and C. And the likelihood is you'll get to your destination in 17 and a half minutes. There may be some bumps on the road, and maybe you want to take the more scenic route, and that'll take a few extra days, or you want to do something slightly different. And we don't know if there's going to be a crash, but we can give you this idea of probability that if I have a heart attack and I take all my meds based on what they see on all the tests that they give me, they'll be able to say, there's an X% chance that you'll have a heart attack again. These are the things that you need to do. And the likelihood is, sure, we know doctors are always wrong, but they will be able to give me a Google map so that I can understand. And I think all of us function in that world. Many of our jobs are Google Map-esque. But when we look with children with medical complexity, as you all know, and in girls with Rett syndrome, where there's a lot of things going on, you may have experienced that your doctors can't give you a Google map, that they can't say to you, oh, yes, we know what developmental regression will look like for every girl. We don't know what feeding will look like years from now. And there's this big piece of uncertainty. And I think as parents, as healthcare professionals, we continue to go searching for our Google map and looking for that certainty. Whereas unfortunately, Algonquin Park doesn't function on Google Maps. And I think that to me is that kind of more radical uncertainty that often we face with children with medical complexity, where we know where you are, we know kind of what lake we're at, and we have this hope that we're going to get kayaking over here at some point. But we don't know how long that's going to take. We don't know if there will be a bear or if actually we're going down a totally different road. And it's this concept of radical uncertainty that I think is really important when making decisions, is that we are all looking for we are all looking for the answer. Especially nowadays, we are looking for how many minutes is it going to take for me to drive to the hospital. But in children with medical complexity, we have a different type of uncertainty. We have this radical uncertainty where we don't have the data because all of your girls are beautifully unique. All of their little complexities are going to decide, every family going in at Rock Lake is not going to come out and have gone kayaking. And I think having this concept in your mind, for me, has seemed helpful for families for when we're not searching for that exact answer. But what we can do when we're in Algonquin Park is use our compass, is say, what's most important to me? What's my true north? Where am I trying to get to? What does quality of life look like along this journey? Maybe some families are getting in that canoe and paddling no matter how rainy it is to make sure that they get to a certain lake by a certain time. Maybe other families are saying, no, it's okay. We don't know what lies ahead, and we're gonna focus on some different things as we try to cross the park. So again, this is the concept that looking for those certain answers may not help with our medical decisions, and accepting this different type of uncertainty may help support how you make decisions for your child. The second piece is clinical narratives. So you see these two lovely characters are looking at the same thing, and they're seeing different things. They're seeing an M and a W. And what we hear from families, what I think I hear from families every day, is people keep on telling me different things. And yes, if you have a heart attack and you go to hospital A, B, or C, they will all tell you that you need to take these 5 meds. But the clinical narrative that the person standing in front of you giving you information may be very different to tell you what they think you should do and what is going on. So you can imagine someone who has severe scoliosis, and if you're trying to make a decision about a surgery, you can imagine that the respirology doctor has a certain view of that because they see all the lung function tests before and after. And so they may feel like, okay, well, all the kids that I see that come back, their lung function is a million times better, or this changes or that changes. Therefore, go for it with surgery because your lungs are bad. The orthopedic surgeon may say, yes, well, I've seen so many kids who are in pain and I've got their pain better. So, yes, I think this is best. The pain doctors who see all the kids who do have worsening pain after surgery may have a very, very different opinion and very different insights. The palliative care doctor who sees a kid who's maybe on the more severe end of the spectrum may have a totally skewed view because we actually see things when they go wrong. And I think this is the thing that, as parents and families, I'd advocate for you to think about, that it's not just what information you're getting, but who are you getting it from? And I think this is where it's important to get different opinions and ask why and get information. Why do you think surgery is right for my daughter? Then get information from other people. Not saying that one is right. Just because an orthopedic surgeon says do surgery, it doesn't mean it's definitely the right thing for your child in your circumstance, because they have a certain viewpoint and narrative. And that kind of sucks as a parent. You want all all healthcare professionals to all have the full perspective on what's right for your child. But unfortunately, that's not the reality. And so this is where I urge you to get the information from the different people when making a decision. But also, look at the framework, knowing that no one is 100% right, especially in complex decisions. The last thing is to think of your generalists. Like, who is your family doctor or your pediatrician? Or, maybe I like to think in that route that I can be the generalist where I can look at all the different things and who's putting it all together for you. Who can say, yes, I see what the says. I see what the orthopedic surgeon says, but I also see the pain side. So how are we going to balance this out together? And so I urge you, especially in complex medical decisions, to look at the concept of a clinical narrative, that a physician, a healthcare professional may be coming from a certain viewpoint to help support how you interpret that information. These are, I think, maybe just what I just said. Um, Take the information from all sources with the acceptance of different narratives to help drive your decision making. No one is right except you. You have all the information, including what is right for your child. And whose narrative is most important to you? Maybe for you, breathing and lung function is something that has a huge impact on quality of life. Maybe pain is something that your child has been, really, really exposed to and is difficult to treat. This may change over time as well. Your decisions about whether you do an intervention based on the timing may totally change. Who's your generalist, as I said. And then the other thing is, what story or narrative do you tell in those appointments that can influence the information you receive? If you go into a clinical encounter and you're not talking about your worries about breathing and pain and not expressing certain things in your story because goodness me, you have to express these things over and over and over again. Does that influence the information you receive? At the end of the day, as clinicians, we're all human. And we want to support based on the questions and the information we receive, but also think of your narrative And how does that change the information you receive on a given day? This is a very interesting one. So, I think in the world of children with medical complexity and girls with Rett syndrome, what I have heard, what I hear every day, and which is true, is if it's going to happen to anyone, it's going to happen to my child. If it's going to happen, it's definitely going to happen to me. And oh, there's my typo. Probability of events, not evens. Although I guess the 6 is an even, so maybe I can get away with it. Um, what I see in children with medical complexity is that if this is a normal child, this picture, oh, a normal child, that is not a phrase I would like to use. This is a neurotypical child without complexity. If they go in for an ear tube surgery, the likelihood of them having that one complication is very low. There's not many 6s in this picture. However, for children with medical complexity, it's different. In this picture, we're going to see lots of 6s. So, as much as each side effect or outcome or negative outcome of maybe deciding to do a surgery, ear tubes, any decision you make in medicine, there's probably a low probability that each of those side effects is going to happen, just like with every child. But we know for children with medical complexity, because there are extra possibilities of all these low probability events, there is a much higher probability that one or more low probability events occurs. So whereas a child without medical complexity can go into a scoliosis surgery and the likelihood of any negative outcome is low, a child with medical complexity is likely to have a negative outcome in some way, shape, or form because there are so many more potential low probability events that may happen. And I think this is important to consider in two ways. One, I think this can stop us from making decisions and moving forward on things because we have this constant fear of if it's going to happen to anyone, it's going to happen to my child. And I think if we look at it through this lens and say, okay, well, what's the thing I'm really worried about and what is the true probability of that? It may help kind of unparalyze us from making some difficult decisions to go ahead. It may be actually part of your healthcare professional's worries as well. It's also the opposite of saying, yes, everyone says there's a well, that's not low probability of this, low probability of that. You know your children well, that there may be a higher probability of something happening. It's not that all the things are going to happen to your child, but something may happen. And I think this is an important concept to help you in making more bigger, complex decisions. For example, going for a scoliosis surgery. They're going to list all the complications, and the likelihood is that the individual things aren't going to happen, but you have a much higher likelihood that one of those things may happen. And I think this influences parents in different ways. And I think just being able to step back and think about it differently, for me, helps me in all ways, just helps me with my decision making. Now, this is the big guy, the concept of being a good parent. So, Pam Hines is a phenomenal researcher from the States, and she started researching the concept of being a good parent. What do parents, especially of children with medical complexity, look at when they think to themselves, how am I being, what would make me a good parent? And there's a lot of the things in the rim her research shows, avoiding negative outcomes, wanting to help others, deciding as my child prefers, um, wanting time left to be good. This is definitely a little bit more of a palliative care slant. And she said the thing that surprised her most was deciding as a good parent would. so that there's a concept within many parents of what is a good parent. I want to make a decision that says I am a good parent. So this concept of being a good parent. And her research has drawn out that you, as parents, have a clear definition of what it means to you to be a good parent. This may change over time, especially if your child's health condition changes. And research really shows that parents think what makes a good parent is different than what clinicians think. And her research, when she's kind of talked to parents about it, have said that many of them said, if I had thought about this concept of how I embody being a good parent, it may have actually helped them make decisions, not definitions, but decisions in hindsight. And so I've been thinking about this so much recently, and I think it's an important thing to discuss with your clinician. What to you is being a good parent? I think it's something important to think about yourself because so many of our decisions, it turns out, so many decisions of parents, especially of children with medical complexity or serious illness, actually revolve around this concept. So actually thinking about it and saying, what does it mean to me to be a good parent can really support you in how you make decisions. We also know that there's going to be, from the research, there's tension exists and will exist between being a good parent and being a good clinician. So me being a good doctor, I may say, it's really important that we do this. And you being a good parent, say, actually, it's really important that we do this. We do something else. And I think we need to acknowledge that we're coming from different places and work together. And ultimately, as clinicians, support you as parents in what it means to be a good parent. So she goes on to, she's really made her kind of life's research around this. Um, and the concept of a good parent has come out with her research is being adequately knowledgeable about my child's medical situation to make informed and unselfish decisions, to advocate for the child, and have sufficient strength to remain at my child's side, no matter how difficult the circumstances, to provide the basic food, shelter, teach my child to make good choices. For many people, help them to know a greater being, and works to be certain that my ill child knows that they are loved by me as their parent. And I'd like you to just take a moment to reflect on that. I'm sure all of these things are important to you. And I think it's important to think how these come into our decisions. Sorry for the blurry side. So when they looked at the themes of all these things, the top three were the ones that families said mattered most. Focusing on the child's health, putting child needs above their own, and making informed medical decisions. But actually, when you looked at what the physicians thought, it was very different. And actually, the ones at the bottom were the ones that physicians thought parents may make. Keeping a realistic output, keeping a positive output, staying at my child's side. And so as clinicians, we're kind of off with this. We're very off with this, which is why I think it's so important that when we're making shared decisions for me, with our families, and for you with your clinicians, that we actually talk about this concept. The thing for me that's really important in here, and I'll go back here, is that, or not really important, really interesting, is that when there was a two-parent family, it was often one parent, and it was often the mother, who felt that the most important thing was to be certain that their child knows that they were loved by me as their parent. And often the other parent, oftentimes the male parent, wanted to be adequately knowledgeable about the child's medical decisions to make informed decisions. However, when it was a one parent primary caregiving situation, it was often the latter, it was the adequate knowledge to make informed decisions. That was kind of one of the most important things about being a good parent. And I think this concept is hugely important to how people make decisions. And I hope that the more that we can actually start having these conversations together and that the parent communities and the ORSAs and everything can start talking about this concept, I think the more that we can support decision making by just being aware of the things that are most important to you as parents and how you can be a good parent and how you make decisions. Right now, there's so many decision-making guides out there, but the one that really stands out to me is from the Courageous Parents Network. Courageous Parents Network is out of the States. It's by parents for parents. It's run by this phenomenal woman, Blythe Lord, who really is looking to advocate and strengthen the parent and family voice, the child voice. And they have a full guide, which you can just Google and find online, about shared decision making with families. And it's how you work together, you as parents, me as a clinician, how we work together to make good decisions. And what I love about this guide is it's talking about all the things that we never talk about. What is your preferred decision-making style and preference? Do we talk about that enough? Do you want written information? Do you want time to go back and talk to your friends and family? Who do you want to hear this from? We don't talk about this stuff. Consider communication styles. You may have a very different communication style than your clinician. How does your clinician need to adapt? How do you need to understand your clinician's communication style so that you can ensure that you get the information that you need? And how do we work together about these concerns about decision making and the fear of regret? Because I think that's one thing that is paralyzing in making decisions is this fear of regret. What if? This is where advanced care planning comes in, but this is where these conversations are so important because those those fears of regret may be alleviated by conversations, maybe help provide clarity. Or maybe there's just a little relief in being able to actually talk about it. I love their other decision-making guides. So what if you have different communication styles or ideas? And this actually talks you through with some really practical language what you can do. If the clinician is making a specific suggestion and you're not sure, please help me understand how this approach will help us reach our goals. And that goes back to having talked about your goals, talked about what it means to be a good parent and how you make decisions. If you don't like the clinician's suggestion, it sounds like there's only one way to move forward. Can you help me understand why you don't think there are other options? And so this guide, I'm not going to be able to go through all of it. You literally just have to Google it, and it's on the Courageous Parents Network site. I think this is huge for helping to improve communication with your clinicians to help support you in making some difficult decisions. Are you aware of this information? I want to make sure your recommendation considers this. Again, someone may be coming from a very specific narrative and not have thought of something that's really important to you. If your clinician is offering a lot of choices and you feel overwhelmed and uncertain, we're trying not to be paternalistic, but sometimes that comes out of just this menu of all the things you can do. There seems to be a lot of different opinions. Why don't I tell you what is most important to us, and then maybe you can help us decide what is best for our family? There's lots of really key things in this guide that can help give you practical language to improve communication with your clinician, especially if you have different communication styles. And these are the things which I hate to say to you. I hate to say, you guys need to do more work. You guys need to do more advocacy. You now need to train us in how to communicate. But this is part of how you are an advocate, and this is part of how you navigate this very difficult healthcare system that we're in. And I think we need to talk about this more, both in clinical medicine, but also in the relationship with our in our healthcare professional family dyad of – what is our communication style? What works for you that I do, and what could be different? What would help you to make this decision? It's kind of like that question for your best friend. Who do you need me to be right now? Do you need me to listen or do you need me to give advice? Do you need a recommendation from me or do you just need information that so that you can go and to do your next step in digesting? This all really comes down to, especially for children with medical complexity or girls with Rett syndrome who are on the more kind of severe end of the spectrum, how do we balance this concept of long-term survival and quality of life? And this is where that kind of discussing realities, maintaining quality of life and hope, this is where this all comes in. And I hope the things that I have talked about today can really help be put together to help with this concept of this, no matter what is happening, how can I have hope? How can I preserve quality of life, but also live in this medical reality where medical things are happening? Be they ICU admissions, be they feeding tubes, be they problems at school, be they not reaching the developmental goals. What are the things that you can put together to try to help you live in a place of reality and preserve quality of life for your child while maintaining whatever outlook at that time is important for you? I think it's important to examine that individual circumstance there and see it as clearly as you can. What is the medical situation right now? What are the real probabilities of negative events or of things happening? When you're getting that medical information, who are you getting it from? How are they telling you? And what are the pieces that you really need to hold on to based on your values and what narrative is important to you? Examining that concept of uncertainty and saying, no, we don't know what lies in the future, but I actually do have to think about some of the what ifs that may happen. What are my values through all of this? What does being a good parent mean to me? And is that living in a place of hope and not going down those what ifs? Or is that really getting all the medical information that I need to make these difficult decisions? Or actually, right now, I just want to be a mom and I want to be by the bedside or a dad. And I think the last thing, which I know at Orsan with all girls with Rett syndrome and in all communities for children with medical complexities, we all advocate for is our child's voice. I hate this phrase, you know your child better than everyone else. Of course you do. That's a given. Nothing could be more true in the entire world. And so this is where, as healthcare professionals, we rely on you. What's important for your child? Is it important that hope and being by the bedside is the mainstay of what we do? Or is it really important to kind of step into some difficult places and examine some difficult things that are going on? I want to let you in on a little secret. And this is something that I talk to my colleagues about all the time. Clinicians sometimes are idiots, and they don't realize that the 10 minutes you spend with us is not just your 10 minutes, the only 10 minutes of your day. And that if you spend time with us and you're talking, about all the positives and the hope and not maybe e- expressing your acceptance of the reality. Some idiotic clinicians think that this is you not understanding. This is my little secret. Don't tell them I told you. And so I think it's really important that you know this because we all know, I don't know who this we is, but in my world of palliative care, we all know that our families fully understand the reality of their situation with any child with medical complexity. And that hope is this beautiful, important thing that is always part of the journey and can never be taken away from the family, no matter what we use, words we use. But I urge you to, when with healthcare providers, help them not be idiots and help them understand that you understand the reality or the gravity of the situation and help them understand how important that hope is to you, that you may not need a feeding tube, or you will be able to take care of your child until you're 92 years old, but that you know the reality is that at some point your child may need some additional care. And I hate that I have to let you in on this little secret, and I hate that I have to put more on your plate. But I think this is an important thing to understand about our idiotic healthcare system, that there's so much that goes on in your world that we don't understand. And sometimes we need these things spelled out for us so that we know that just because you're sitting in a place of hope does not mean you don't understand the reality. Because I know you do. Lastly, I think when trying to examine that concept of quality of life and reality, and making difficult decisions, it's important to think, as my very good colleague, Dr. Zuniga, teaches about, is this concept of quality of life, suffering, and what that means to you and your child. There's neutral states of not suffering. And for so many, that is a wonderful, good quality of life. Whereas for others, they need those quality of life enhancers to feel that there's quality of life and a relief of suffering, not having the negative. And I think this is where, as healthcare providers, we need to understand more from families and from you about what that quality of life is for you. What are the things that make life worth living and worth being here? The really important things like friends and school and family. And what are the things that bring suffering and kind of reduce quality of life? And for you to examine those so that when you are making difficult decisions, you are able to kind of put these into your equation. Well, they wouldn't be able to go to school for 2 years, or we know pain is really bad for them, or this could really help because this will get them back in the pool. And so this concept of kind of the scale of quality of life and suffering, Dr. Zuniga will do a much better justice to this, but I think is important when we're looking at these difficult decisions. Lastly, and I'll go through this quickly as I know I've rambled for some time, please, 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 if there's any resource you check out, please go to the Courageous Parents Network. It is US based, but I think there is nothing about it that isn't relevant to us. They have a few key resources. Navigating Medical Complexity is one, where they really go through beautifully lots of different topics and a journey map to really talk you through this kind of navigating, especially for those new to a diagnosis. They have a neuro journey where they're looking at children who are neuroatypical and looking at kind of how you can help support a family through adapting to diagnosis, building strategies, suggesting to change, and navigating decline. If you go on to their site, you can and Google Rett syndrome. I think there's about 77 hits. This is a site that is for parents by parents. And so there's lots of the doctor shuffle diagnosing Rett syndrome. So there's a few specific Rett syndrome videos, and it can just, if you're making a difficult decision about a G-tube, you can see lots of parents and how they did it. There's no agenda to it. It's not like one parent where the G-tube went well and one where it didn't. It's just parents sharing with parents. And this neuro journey is new and absolutely phenomenal. Lastly, very recently, kind of in the last few weeks, the Canadian Pediatric Palliative Care Alliance has launched its website as well as its big platform. This is something that all of us are working really hard towards to create continuity across the country. And what I love about the Alliance right now is that they have beautiful kind of work. So for example, Transition to Adult Care in Canada, a general guide. So this is written by someone out in Ottawa, Deanna Ward, who's wonderful. And we can see that there's these beautiful resources out there which may be relevant to so many families. You just have to go into their resource hub. You have to sign up. which is obviously all free. And you can get these beautiful, beautiful resources that can kind of help you navigate lots of different things related to children with medical complexity. Yes, there are things about pediatric palliative care and end of life care, but a lot of it is around children with serious illnesses and navigating all the different things that comes up. So for me, this is a new huge resource. Um, some wonderful things on there. I won't plug my own guides, but they're there too. That was a whirlwind of information. I hope in one small little way I have blown your mind and made you think about something in a different way, be that the probability events, clinicians' narratives, which I think blew my mind when I started to read about it, or the different concepts of uncertainty. Or maybe it's just something little that you want to think about in the future of your child that you haven't yet kind of addressed either in your own household, in your own brain, or with your clinicians. Stop sharing there.
Thank you so much, Dr. Humphreys. That was a very thought-provoking discussion. And I sit here and I'm trying to take it all in with a couple hats, right? Like as ORSA president and as a mom who has a child with Rett syndrome and also someone who works in healthcare. I'm just yeah, I took 3 pages of notes, so I'm gonna process this all probably tomorrow morning after I get a good night's sleep on it. But thank you so much. Um, this is exactly what we needed, just to help us problem solve, right? And I think I do have a few questions for you, but I'm gonna open it up to the floor first to see if any of other our guests have any questions, and then we'll go from there.
Thank you, Sabrina. I do realize that some of these concepts could be and are entire talks in themselves. So I do appreciate you and everyone who's watching for letting me run through them with a bit of speed.
Does anyone have any questions for Dr. Humphreys?
I have a couple. Dr. That was amazing. Thank you so much for speaking on a topic that I think I think it's important to talk about. I think the thing that hit me the hardest is when things are going well, that's when you need to talk about it, and that's when you
Mm.
don't talk about it. So I think that's kind of the golden nugget that I've taken away. But I was wondering if you could give us a little bit of insight on whether different families approach ACP in different ways based off of any cultural or socioeconomic difference.
Mm.
Because I can tell you in
Definitely.
my culture, it's very different when it comes to sort of this sort of forward planning. And I imagine it would be in another. So I'm curious from your lens what you've seen.
Amazing question. Thank you. And I would say I would take culture in every way that you could define it. I think every individual family has their own culture, as well as kind of larger racial or ethnic cultures, socioeconomic cultures. And yeah, I think everyone approaches these conversations very differently. We know there are some people where this is a decision made by religious figures where kind of what you would do if a child were to become unwell is something that you would go to an imam for, or you would, look to the Quran to try to figure out. Some these decisions are made by the elders. So it's the grandparents who are coming in and saying, this is what we're doing. Some it's made by a certain person in the household, and that can sometimes be the primary caregiver, which we know is often the mother, and sometimes not. Sometimes that's the father figure who is doing that. And I think that's especially important when we look at this concept of being a good parent, because in in families where there's multiple people involved in these decisions, they may all have a different concept of being a good parent, which may lead them to feel a certain way about certain decisions. And if these decisions are made by one parent or one person, whoever that is, their concept of being a good parent or being a good caregiver may be very different. And that's where I worry a lot about decisional regret, when if the thing that's most important to me isn't actually carried out through this decision making. Um, and I didn't actually have necessarily, the person doesn't necessarily have control in there. Two, because they're not the person making the decision. How do we do that? I even find in couples, like I ask couples, how do you guys communicate? How do you make decisions? And it's amazing how many couples don't have an answer to that. I don't think I have an answer to that. Um, but even in just the small culture of a family. And I think this is why, as clinicians, sometimes we do need steering because we may not fully understand the quote unquote culture that you live in. It is our job to do our best to understand and to act with curiosity. But there are some nuances that we may not understand. And I think that's where we really want to be working in tandem with our families to understand where they're coming from, understand what's important, understand how they make decisions so that we can support in the best way possible, knowing that that may not be the way that I make decisions as a human, or that the majority of the way of my parents make decisions, or patients. And so that's where we really need to have humility to kind of understand and support people in their decision making, and sometimes try to guide so that we can help support. I don't want to say help support different ways of thinking, but help people to examine how they're making decisions and ensuring that that is the right way for them.
Thank you.
Any other questions? Well, I'll ask, I have three questions, but they might just merge all into one. So I'm thinking, with advanced care planning and being a part of a complex medical team or someone who you would look after, I think the patient has to be classified as complex, right? So what happens if you say, like, you're starting your journey, you just got diagnosed, you may not have a whole bunch of different providers, you may not
Mhm,
be eligible to be on part of the complex care team.
mhm,
Can somebody ask to be referred to a complex team so they can actually start having these conversations, or can they
mhm,
have these conversations with their pediatrician? After talking or listening to you, you have the knowledge. This is what you're passionate about. This is what your education is around. It's not necessarily the same for another specialty, right? So I'm just wondering, how does a family navigate something like that when they're just starting their journey?
Great question. Yeah, you're totally right. And for wonderful reasons, many families won't qualify to be with a complex care team, and fortunately, a palliative care team like myself. And so I think the right place to start is your pediatrician. I think it's even harder in some areas where you don't even have a pediatrician. You've got a family doctor. Um, Love family doctors. But again, that expertise in having these discussions is getting kind of slightly smaller. I think it's going to the person that probably has the greatest expertise in your circle. That may be your pediatrician. If you're lucky enough to be in a catchment where there is a Rett syndrome clinic, obviously there. And then if there are specific questions, then you ask your pediatrician or your family doctor and say, these are things that I'm not finding that we can do here. Who can I go to have these conversations with? And maybe that means a referral to a Rett clinic, even if it's virtual. Maybe that means even just a one-off consult with the team, like my team, like a quality of life team, or a medical complexity team, or a pediatrician with the explicit goals. I think that is harder because we did a study on advanced care planning for children with cerebral palsy, and we expected that it was the kids who were kind of most severe who really wanted to talk about advanced care planning. And what we found is that everyone wants to. And it's the kids with GMFCF 4 or 5, or kids who are more severe that actually have those teams that are a little bit more proficient in it. But what happens to the kids who are less severe? And I think that's a real problem right now with the lack of Rett syndrome clinics, because I think that would be the ideal place to go because it's people who know the future. And so that's where maybe it's advocating for a one-off consult at a clinic where there are things that you do want to talk to. But it's a very, very good point because fortunately, most girls with Rett syndrome do not need my services and do not need a complex care team. And unfortunately, as I say in every Rett syndrome survey that I fill out, there are not enough primary Rett syndrome clinics to be able to support these important conversations.
I like that. I like that there's an option to do like a one-time consult or something like that. Just so you're not it's another appointment on families too, right? So it's not the flip side of that is that we still have to open up our schedules, make that appointment, go to that appointment. And so maybe at that juncture of your healthcare, you might not need those 3-month visits or those annual visits, but you might need a touch point to say, hey, I have these things that I need to talk about, and you have the most knowledge, so can we have that
Yeah,
touch point?
yeah,
I like
it's
that. And then I guess the hot topic too is the transition to adult world and how that would I know like I that's a loaded question. I don't know we don't have time to discuss all that, but I did see that in the Courageous Parent Network, which I am going to post all these things on the ORSA website. So I'll have the links and the diagrams up there for our families too, and send
thank
that
you.
out to our community because they're very, very helpful. And it's just another tool, like you said, in our toolbox. And I think the thing is too, right, how do we transition from pediatrics to adulthood and finding the adult support who will help us navigate these questions in the future? So I guess, you know, um,
The
those are
million dollar
uncertainties.
question.
And I get that's part of this whole decision planning, and the fear of the unknown for a lot of our families.
Yeah. And all I can say is to continue as an organization or as a continuous parents to advocate for improved supports for transition to adult care.
Hmm.
It is a huge problem. Um, uh, we are constantly trying to do it better, trying to work on it. The resources don't exist. The resources don't exist. If people are having trouble finding someone to have these conversations with in the pediatric world, then, let's try to do that in the adult world. It's even harder.
Yeah, and I think, one thing like I don't know if I'm out of place saying this, but I know the adult world is even hard on neurotypical, like even us as adults trying to find a family physician or trying to find a specialist. And so like it's I think across the board it's a system issue, and I think that we have to understand that's not just about our children with Rett syndrome. I think it's a greater problem that it's just the specialty or the numbers aren't there to help support the growing population that we do have.
Yeah, and I think that's why you continue to advocate. In the adult world, there are people, there are teams who can have conversations about the future. It may be a cardiologist talking about the cardiac things. It may be a GI specialist talking about the GI things, but there are different ways to understand kind of for the future. Um, uh, Especially kind of for children um, on the kind of the spectrum of severity that is more severe, consults with palliative care teams, you know, they are asking to meet people and not, palliative care in the adult world is mostly just end of life, but it doesn't mean you can't go and have a conversation and have a one-off consult. If your child is ending up in hospital more and more and you're worried about what the future may hold. And I think for children on the opposite end of the spectrum, that's where we really need to push our family physicians, being like, okay, so you can't have this conversation, but who can? Are
Mm-hmm.
there good occupational therapists? Because one of my questions is about function for the future. Do I need to be seeing a social worker to help me with planning for what happens if I can't take care of my child as I age? You know, it's finding and advocating to find the right people in the system, as hard as that is. Again, it's more work.
Hmm.
But there are people in the adult system, they're not going to fall on your lap, but there are people, and it may not be that one person. You know, I would hope that I could help navigate a lot of this, but it may be just looking for those individual pieces from individual
Hmm.
people.
And then one thing I did, I don't know where I heard this, but it really made a lot of sense was, we do as our children are in pediatric care, they do or may see a pediatrician with a family doctor. But the one recommendation was to ensure that you keep your family doctor in the loop because it's your family doctor that's going to be there through pediatric into adulthood. So they're going to be the ones that know your child from this for this whole journey, and they're the ones that are going to advocate for you the best with these transitions. So as much as the pediatricians are so great in helping us with the more acute issues, the for the chronic long-term stuff, the family physician is going to be your foundation that's going to help with the transitions.
And we advocate for that so strongly. Your family, you know, so much about what we're talking about today is the nuance of your child, is the nuance of your family. And the more you can get to your family doctor to understand, they may not understand the Google map, right? Like they
Mm,
may not have the A, B, and C and you know, route one, two, and three, and you may need to go to a specialist for that. But if your family doctor knows what your true north is, knows what's really important to you, knows your values, knows you, cares about your child, and has kind of seen the journey through all the letters and notes and visits, you will be setting them up for success to be able to care for you once your child transitions away from a pediatrician. And it seems ridiculous that you have to do that work. But building relationships, building rapport, understanding values is so important in any child with even minor medical complexity that I really strongly advocate for the investment in that relationship as time consuming and hard as it is
mhm.
sometimes. Even if it's just you're going to go there for your flu shots,
Yeah.
you're going to go there for so that they see our children grow up, so that they see them, so they understand who you are as a parent. You know, I think they are in a much better place to understand and support you, even if they don't know the nuances of the medical decisions.
Mhm.
So yes, I agree.
That's all for me. I don't know if anybody else has anything else or any questions, any comments, thumbs up.
I have a comment actually. Koala was the best thing we ever did. And
Mm,
it's not palliative care, folks. Well, it is, but it doesn't have to be. My
No.
daughter has been supported so amazingly during hospital trips, during future, during a very, very bad sickness. It was the best thing.
Cassandra, thank you.
I may be a little biased because, Dr. Humphrey is our main doctor at Koala, but besides the point, it was the best thing ever.
you're not
Thank,
biased.
thank you for saying that. That means so much. And I think that's what we're trying to get across is that we're not the end of life doctors. We are the quality of life doctors. And children need that for lots of different reasons. And we want to try to support that as best we can.
I have a question actually as well. My daughter, Rett syndrome, she's 14. Now we do deal with McMaster a little bit, but again, we're not, I guess, complex enough like Sabrina was talking about, so we don't have a complex care team through McMaster. Now we do see the Rett clinic at Holland Bloorview, so I believe they're kind of like our complex care team, which is great, but we just go there once a year to kind of, they oversee her and everything. But now we're going to have surgery at McMaster. And I've been told I have no complex care team there because we don't qualify for one because we don't see enough people at MAC. with not having very much complexity. So just when it comes to her surgery now, I do have a meeting with a team, but I don't like, they didn't really let me know like who's going to see us. They just said somebody in there would oversee my daughter after her surgery, but like, so now we just don't have a team to follow us. Like, but you're saying that maybe we could do like I don't know, a one-off, or like, how are we being looked after a surgery type of thing?
Yeah, and I think that's where those are really important questions. One for your surgical team, and saying, this is where you need to communicate that like I need more than someone's going to take care of my daughter. I need to truly understand who are those people. What's the wraparound going to be like? Who's taking care of pain? Who's looking at the surgical stuff, but who's also looking at the medical stuff? Because, you know, because of A, B, or C, medical concerns that your daughter may or may not have. I think the consult to the quality care team in that case, or for people watching to a more advanced care team would be is if you do have questions about advanced care planning, like what if the surgery doesn't go well? What is happening? And if those worries are there, again, there's no harm asking for that consult and for a team to be able to have those, conversations with you and potentially be an additional support around surgery, even if that's not something that is needed in follow-up long term. This is where I hate that it takes parent advocacy to get to this stage, but all tertiary care hospitals have teams like mine, and I think it's especially important to advocate for that information you want. And then if you said, okay, well, if you guys can't give me this information, then, who are the teams that would fully support me in hospital and can I meet them? And that may not be a palliative care team, that may be a complex care
Right.
team that like we want a one-off appointment with them. Can we do that? The complex care teams, unfortunately, are a little bit harder to get into.
Okay.
But then, even if it's not, maybe not in your situation, Amy, but for other parent situations that is not an appropriate, like we just need to know about pain control. This is the advocacy. This is the pushing and saying the communication style with our orthopedic surgeon is that we are not having enough transparency. How can I get this? Maybe I need to meet with a nurse practitioner. Maybe I need to go back to my pediatrician and ask them to advocate to get more information for me because I don't feel that I've been adequately prepared to potentially make decisions around this very big surgery or to understand enough.
Yeah.
This is where I hate that my whole talk is just, hey, you guys should advocate more, because I don't think that's the right situation. But I think there needs to be a greater understanding in the medical community that there's so much more complexity in making decisions for children with any degree of medical complexity, and
Right.
that just because you don't have the highest level of complexity doesn't mean that the decision making isn't as complex, and we need to support you in that.
Right. All right. Thank you.
Of course.
Well, I think we've reached 8:30 soon, 1 minute too. So if no one has any other questions, I just want to say thank you again for spending your evening with us and for educating us on this wonderful discussion. Also thank Acadia Pharmaceuticals for sponsoring our Rett rounds and all these series that we are having. After tonight, we will get these uploaded to our YouTube channel so that everyone can have access to them and also provide the links on our website. So I think that's it. If anybody has anything else to say, I'm going to say goodnight. And thank you so much for joining us.
Thank you so much, Dr. Humphreys. Good night.
Thank you, everyone,
Thank
for
you.
Thank
tuning
you,
in,
everyone.
however you do
Good
so.
night, guys. You want to stay on for 1 sec?
Sure.
Awesome. Okay, so let me
Are
stop
you still
recording.
recording?